Hi, I'm Jeff Sharon from UCF Sports Night. You can now watch UCF TV 24 hours a day on Bright House Digital Channel 1.
Hello and welcome to Public Affairs Today. I'm Alicia Callanan Mandigo. This is a show designed to introduce you to public affairs, which is a much more dynamic field than you might realize. On the table today, the government's use of grassroots feedback to reform our healthcare system. And with me today is Dr. Thomas Bryer, an assistant professor from UCS College of Health and Public Affairs, Department of Public Administration. Welcome and thanks for joining me.
Thank you.
So we're going to talk about healthcare reform and the town hall meetings that Tom Daschle has been organizing around the country. And you have used words like innovative, unprecedented, empowering. I mean, this is pretty big stuff, and these are pretty strong words that you're using. So tell me a little bit about why you're seeing things this way.
Sure. Well, typically when we think about the ways government seeks to include citizens in its operations, in its policy making, or its oversight and evaluation, implementation of services, it's usually a one-sided activity. Governments tend to invite citizens to participate in town hall meetings, public hearings, community meetings of various kinds, but they define the place, they define the time, they, for the most part, define the agenda. And as a result, a number of citizens don't have the opportunity to participate. Meetings are often scheduled in the middle of the workday at a centralized downtown location, for instance, so that requires people to take off work, perhaps sacrifice some salary in order to go and participate with government. Or they might be held at 6:30 at night. Well,
dinner time,
kids. That's family time. So the costs of participation for individual citizens are really quite high with these traditional forms of engagement. What the Obama administration is doing with Secretary-designate Tom Daschle is really very innovative. They're saying we understand that citizens have a lot to say, have a lot to offer with respect to healthcare and the healthcare system. So go, have your conversations. Have those conversations at a place of your choosing, at a time of your choosing, your home, your office, a coffee house, a restaurant, wherever you want. We have some suggested items you can discuss, some discussion questions during those meetings, but you can discuss whatever you want. Just report back to us on your discussion. Report back to us on the problems that you identify with the healthcare system and some possible solutions that you perceive for the healthcare system. So really it's an innovative way to recognize the true value of the insights that average Americans, average citizens have.
Well, like you, I'm excited about the idea. Healthcare is one of my personal soapbox issues. I am a single issue voter. I vote on healthcare. So when I thought about the idea of participating in one of these grassroots meetings, town hall meetings, I looked at myself and thought, well, I would probably go there and do a lot of whining, but I wouldn't come to the table with any solutions because I don't have any. So how do you make the meetings productive?
That's a great question, and I think you'd be surprised at the kinds of solutions you might have in your mind that you might not be aware of. Most people who came to the meeting that we hosted, and we'll talk a little bit more about that, I hope, a number of citizens who did come to that meeting offered their complaints, offered their criticisms. Really, those are loaded words, negative words. They offered their experiences in trying to navigate the healthcare system. What some of them also did, though, was recognize through discussion with others, through hearing other people's stories, that they share some common experiences, and once one person identifies a possible solution, they build on that. And they say, oh, well, I agree with that idea. Well, how about we do this as well? And you might think for your own personal experience, how often you might be sitting in the doctor's office and you think, oh gosh, I wish they used a different filing system or a different procedure for diagnosis or different relationship between the medical provider and the insurance company. You might not recognize it, but those are policy solutions. Those are ideas that can be translated into public policy to help improve the lives of countless people.
So I do want to talk about the town hall meeting that was hosted here, and you were the organizer?
Yes.
Okay. So I want to first learn what were the suggested topics that were given to you, and then how things went from there.
Sure. Well, the Obama team suggested a list of 8 to 10 questions, possible discussion questions. They advised that the group should be limited to about 20 people to come and allow for everybody to engage in discussion. And that was, the questions that they suggested included a focus on problems experienced in the healthcare system, possible solutions, identification of current practices in the healthcare system, and a healthy lifestyle. For instance, how do people eat? Do they go get preventative care? How often do they go to the doctor? Really, they were looking for stories of the experiences that average Americans have trying to navigate the healthcare system, and experiences Americans have trying to lead a relatively healthy lifestyle. We were, at least I was, overwhelmed by the response. We convened the forum on December 22nd, 3 days before Christmas. I was expecting very low turnout. Semester break, very few people are around campus. I would have been pleased if we had 10 people. NPR picked up a story on it, a local TV station picked up a story on it. We had about 70 people show up.
Wow.
Incredibly.
Wow.
70 people showed up, including, this is one of my favorite stories, a couple from North Carolina who heard the story on the local NPR station, WMFE. The gentleman called me up about 7 o'clock the morning of the forum and said, well, I just heard this on the radio, and my wife and I were on vacation here. We were going to go to Disney World, but I think I'd rather come to your forum and talk about healthcare. So
unbelievable.
Really the overall experience was a demonstration that if we invite citizens to participate in a policymaking process, when they are at least given the impression that what they say will be paid attention to, there's a lot of interest. People will show up. They want to show up, particularly with something as sensitive as healthcare. Every one of us has a story about healthcare. So give citizens an opportunity to be heard, to participate, to share their experiences, their ideas for improving the system, and the response can be, as was demonstrated here, absolutely overwhelming.
Now, were you charged from the beginning with taking the information from the meeting and putting together a report, or was that a matter of initiative on your part?
The Obama administration, the transition team, did ask for all of these discussion forums to conclude by December 31st with a written report by January 4th.
Okay.
What a written report meant was open to interpretation. So I wrote a 5-page summary report with some graphics and some tables indicating what the key ideas were that were expressed during the meeting. Most of the report, the overall document, is about 50 pages. What's the rest of it, you ask? Well, a lot of citizens submitted their own letters, their own documents. They wanted to express beyond the words they use at the meeting what their experiences were, what their ideas for possible solutions are. And so I included all those letters. It's not my place in this environment to screen those letters or to interpret or suggest some are good, some are bad, some are relevant, some are not relevant. It's all part of the report. It's all part of what the residents of Central Florida are saying about healthcare, and that's all been transmitted to the Obama team.
So what can you share with us about what people in Central Florida are saying about healthcare?
Well, there are lots of diverse needs. We had some really remarkable stories at the meeting. One woman, a young woman, was with a pre-existing condition, which came to the meeting with 2 small kids in tow, and reported on the struggles of trying to, one, get affordable insurance not only for her and her husband, she with a pre-existing condition, but also getting coverage for her kids. She reported that she had to go months before giving her children proper immunizations because there was no coverage available for that. And that kind of story is obviously something we don't want to hear. That's something that we need some kind of correction for in our public policies. Others reported challenges or concerns about affordable care, not only for themselves but their loved ones, and how do we get there. We had quite a bit of international experience among the participants, suggesting possible applications from healthcare systems in Cuba, Germany, England, Argentina, and how we might be able to learn from those countries, from those examples. So overall, the lessons that we might apply from the discussion here in Central Florida, and this was only just one of them, there may have been others as well, is that there is a great diversity of need. Healthcare system is not an easy, the problems in the healthcare system are not easy to fix. It requires the best minds coming together, not only experts in healthcare, but citizens with their unique experiential knowledge coming together to shape the future of the healthcare system. The complexity of the issue requires this kind of public participation. Without it, the solutions that are developed may or may not actually address the actual needs, the real needs of real living people.
Clearly, there were some personal stories that stood out for you. Were there any suggested solutions that stood out for you?
Every idea that was expressed has value, and every problem that was identified has a story with it that suggests other solutions.
And that is the big question for you. This is your report. You've brought it with you, and the question is, what happens next? What will they do with it? And you've been giving that question some consideration.
Yes. I don't know. That's the short answer. But if they take the report, this report and the reports, I'm guessing hundreds, maybe more, of reports that were generated from around the country, if they take those reports and use the stories and use the ideas to develop policy solutions, this can be a remarkable experience that can be replicated across policy areas, not only health, but environmental affairs, transportation, education, even these tough economic issues that we're facing right now. If they use the report to generate policy solutions, it's a wonderful thing, a wonderful innovation. My concern, my deepest concern is that the Obama administration, the health team, led by Secretary-designate Tom Daschle, will take this report, take some of the stories that I've just identified, and pick those that substantiate their pre-identified policy solutions. If they just do that and exclude all of the otherwise good ideas, or at least valid ideas, then that's problematic. That will prevent the kind of innovation that I really do believe is necessary to increase and enhance trust in government, to increase what we mean by citizenship here in the United States. So that really is my biggest concern, that they'll just cherry pick and not use the unique experiential knowledge of citizens to truly inform what they do in this policy arena.
In the meeting that you organized, was there a single theme? Was it cost, cost, cost?
No, I mean, that was a big part of it, clearly. Cost and affordability and the availability of insurance to cover these costs, particularly insurance that would be made available on an equitable basis. That was one issue that was returned to a few times during the meeting, just the lack of equity, the disparities that exist between different classes of individuals, both economic classes, social classes, and otherwise. So cost and affordability is certainly one issue. Access to care, access to quality care, there was some concern, and that's a disparity issue as well, that for individuals who choose the lower cost insurance programs, they're often restricted to what they perceive to be a lower tier of quality providers. So how do we deal with that issue? Are we necessarily relegating some portion of our population to low quality health care? And that's a valid question to ask. I don't know what the answer is, but it's a valid question to ask and for the Obama administration to consider. Really, there was no single theme, and that again demonstrates the complexity of the healthcare problem and the need for this kind of public participation process.
Do you think we'll see more of this? I have a hard time believing that we could do a short stint of these type of meetings and get the information that we need. But at the same time, I think, well, okay, so if they go on for a year, or go on for 2 years, then we never get the answers.
Yeah, I hope we do. I hope what they will do with these reports is develop a comprehensive package of healthcare reforms, and that they'll send it back out to the citizens and say, okay, we've heard what you've had to say, now here's our proposal based upon that information. Have another round of town hall meetings, of house parties, of community forums, and report back to us on your analysis, your evaluation of whether or not our proposals will meet the needs that you have identified. That's my hope. But there is an interest in continuing these kinds of dialogues. After this forum, I was contacted by one of the participants, Judge Jose Rodriguez, a local civil court judge. He has connections to the Cuban community in Miami, and so the two of us will be traveling to Miami in the coming weeks to convene a discussion forum with Cuban-trained doctors, some of whom are licensed to practice in the United States, some of whom are not, but we'll be convening this forum to learn from their unique experiences, from the Cuban medical model, what we might be able to learn, what lessons we might be able to apply. Now, the Obama team is not asking us to do that. I think there may be some concerns if we say we're going to borrow liberally from the Cuban model. But we're going to do it. We're going to generate a report, and we'll transmit that information to the Obama team and anybody else who might care to listen.
You know, that's interesting because certainly you can see the political implications with that, but having grown up in Central Florida and being the child of a Latina, every doctor I ever had in my entire life was Cuban, and I've always considered them to be excellent doctors. So I can see the value in going down there and having that dialogue.
Having that dialogue. Well, my understanding is the Cuban model of healthcare provision, it keeps the cost down for the individual patient. Now, that's an expensive proposition, but there may be some lessons to be applied from that to more evenly balance the cost to an individual with the cost to society to ensure that all individuals are at least given the opportunity to lead a fully healthy lifestyle.
Now, it's really interesting that this particular issue, the town hall meetings and the grassroots approach, falls into an area of wider expertise for you, which is looking at how we can help government and non-governmental agencies and not-for-profit agencies do a more effective job of working together. So tell me about how your experience in that area plays into this.
Sure. Well, the healthcare problem is a prime example. Homeland Security and emergency management is another example, and we have a certificate of emergency management, Homeland Security, in the Department of Public Administration. Transportation planning, land use planning, all of the issues we're facing in our contemporary society are so complex that a single sector, the government, cannot solve them on its own. It requires the collaborative partnerships between government, nonprofit, for-profit, private, and individual citizens coming to the table to not only plan for possible solutions to the problems that we perceive, but to implement those solutions as well. So I can identify several examples of these kinds of collaborative partnerships. I teach a class called Cross-sectoral governance that asks students to go out and evaluate these cross-sectoral partnerships in the Central Florida community, or to propose a new kind of partnership or network that might address a problem that they perceive to exist. The challenge is designing them in such a way where they can be sustainable. And that really is the biggest challenge that we face in governance and government, trying to bring these parties together that have unique cultures, unique backgrounds, unique interests, bring them together around the same table to give up their idea that, well, if I share this information with you, then suddenly I lose that power. Or I'm being willing to share some credit for work that is done well. That's not our culture. Our culture is more of a competitive culture.
Mm-hmm. Mm-hmm.
So how do we get people to break away from that competition, to understand the need for sharing resources, for changing mission statements, things like that in order to solve the problems that we face?
I would think that another conflict, and that's interesting because I wouldn't have considered our very proprietary nature that we do have as Americans. I was thinking if government is always going to be a piece of that collaborative puzzle, then we have the partisanship problem in which too much government, not enough government, and that changes every 4 to 8 years. So when you're speaking about building a model that's sustainable, how do you get past that?
That's a great question. That priorities do change as our elected leadership changes. Public administration, the bureaucracy tends to stay rather consistent. So that's where the opportunity for developing sustainable partnerships emerges at the level of the public administrator. That said, my perception and perspective here is that we need to consider a reorientation, a reconceptualization of what we actually mean by public and who's responsible for addressing the needs that we have as a larger society. I just spent this past weekend in Arizona with some wonderful colleagues, Tom Catlaw from the Arizona State University, Margaret Stout from Bridgewater State College, and Kyle Farnbury from Rutgers University. We're working with other colleagues now on a project to do just this, to give some new thought to what it means to be part of the public sector. And I say sector in quotes here. We said we want to think about getting rid of this whole idea of sector-based society. Is it necessary to say the government will do this, the nonprofit will do this, the private sector will do this? Well, no. We've already identified that these boundaries are blurring, that it requires public, private, nonprofit to come together to solve the tough problems that we face in society. The question is, are these boundaries so blurred that the idea of sector currently is absolutely irrelevant? So what we're suggesting, these colleagues and I that are working together, is that we change the whole frame of what it means to be operating in the public sphere, in the public sector. That everybody, regardless of economic interest, has obligations towards the pursuit of some common good, some social good. And as we go into the Masters in Business Administration programs, or Masters in Nonprofit Management programs, or Masters in Public Administration programs, we need to teach some common set of values regarding what it means to be an active participant in society. That's fine if you want to pursue a business degree and a business interest in order to secure some personal profit. That's okay, but understand that with that drive comes the need to contribute to the larger good of the society, in whatever way that might be.
Okay, well, that's really interesting. It's a really interesting concept, and I'm thinking it's something that's might take a generation or so to really sink in, but unfortunately we're out of time. We would like very much to have you back, and I hope that we're able to do that, but in the meantime, thank you very much for joining me. I've been talking with Dr. Thomas Bryer, an assistant professor from UCF's College of Health and Public Affairs, Department of Public Administration. And that's it for now. I'm Alicia Callanan Mandigo. Thanks for watching Public Affairs Today.